Well, it's a startling statistic. More Americans abuse prescription drugs than cocaine, hallucinogens, and heroin combined. That's according to a 2009 study by the Department of Health and Human Services. And many people point to Florida, which has the worst problem in the nation. Joining us now to tell us more about what they're doing to fight, Florida Governor Rick Scott and Florida Attorney General Pam Bondi. Great to have both of you here. Thank you so much. Governor, great to have you here in studio. Let me ask you first, 1 in 7 deaths in your state tied to prescription drug abuse. What factors have led to this in your state being called the epicenter for prescription drug abuse?
Well, we haven't had enough focus. So Attorney General Bondi and I just got elected in November, just took office in January. We put together a strike force that we're going to work with our local sheriffs, local police chiefs. We're going to provide money. We're going to provide investigative research to crack down on this. We also have a great bill coming through the House that will prevent doctors that prescribe from dispensing drugs or owning a pharmacy. And we're going to track from the manufacturer to the distributor to the doctor because we're going to stop this. Attorney General Bondi today was with an event, I think, of the National Drug Take-Back Day. We're also working on education, get drugs out of the house, things like that.
Attorney General Bondi, this is a very tough issue to confront, no doubt, but why do you think having a database in place for prescription drug monitoring can make a difference when you're trying to shut down the pill mills?
Well, it's a comprehensive plan, as the governor said, and he's been great. We've started a task force, and he's devoted a lot of funds to that. At least 7 people a day, Uma, are dying in our state because of prescription drug abuse. But what we have is it's a comprehensive plan. So once we go in, we have tough criminal penalties. We have really tough administrative penalties. We have dispensing ban, as the governor said. But once we have all that in place legislatively, the prescription drug monitoring program, what that will do, it will prevent people from going to doctor shopping. And that's what they're going to do next. And so what that will do, it will have a database with all pharmacies combined in one place, and we'll be able to confidentially, through the Department of Health, law enforcement will be able to use that as a tool to prevent shopping. And it's also an educational component as well. And as the governor said, it's National Drug Take-Back Day, and today you can go anywhere around the country. It's sponsored by DEA. Turn in your unused prescriptions because our kids are getting in our medicine cabinets. And that's what's happening. They're going in, they're taking these drugs. So we're trying to hit it from all different angles.
So how easy is it today, Governor, for young people to get access to these prescription medicines, particularly painkillers today,
it's way too easy.
Use?
There's all these pill mills all across the state. There's all across the country, but there's a lot in Florida. It's easy to go in. If you pay, you can get what you want. So we're gonna start from the manufacturer to the distributor to the doctor to the user, and we're gonna stop this. And we're working with the sheriffs, as Attorney General Bondi said. We've got a comprehensive plan to deal with all these things. And we're going to track all of it, and we're going to stop it.
So when you have this day set aside to turn in these kinds of medications from your medicine cabinet, I mean, how effective is that, knowing that there are old medications that people do keep? That's one piece of the puzzle. But,
it's very effective.
But the other part is, of course, trying to shut down these pill mills.
We've got to educate our kids. You know, the people, Attorney General Bondi and I had a friend that his 18-year-old daughter just died of an overdose about a month ago. It's impacted everybody in our country. You know of somebody. So it's education, it's having the right laws, it's preventing people from dispensing, doctors that prescribe from dispensing, and also own pharmacies. It's just everything we're doing is going to crack down on this.
But Attorney General Bondi, isn't it also though going after the doctors and the dealers who are out there making it easy for young people particularly to get access to these meds?
Uma, that's exactly right, and that is our #1 priority. These are drug dealers wearing white coats. We have a lot of great pain management doctors, but that's not who these guys are. They're a cash-only business. It's $200 to $300. They have armed guards at the door. There are lines of people around the building, and they're drug dealers, and they're addicts going in to get more pills. And once the governor and I and the Senate get done with our legislation, we're going to do everything in our power to put them out of business because we've got to have people stop dying from this.
Absolutely. Well, I wish you both the best on this project because it's certainly needed and something that we need to do to keep young people safe and keep them alive.
Yeah. It's impacting everybody's family.
Absolutely. Governor, thank you. Attorney General Bondi, thank you very much. All the best to you.